Now let me discuss about the other important drug, that is pyrazinamide. Remember, pyrazinamide, this is a weakly bactericidal drug, right? So this is a bactericidal drug. Now this particular pyrazinamide is more active against the slowly replicating bacteria. Alright, it is active against the slowly replicating bacteria. Okay, next. Rather than rapidly acting multiplying bacteria or rapidly multiplying bacteria, this pyrazinamide is more active against the slowly replicating bacteria. Right. And not only that, this particular pyrazinamide is also active in the acidic media. Right, it is also active in the acidic media. Now, another important point is that this particular pyrazinamide is effective only against the intracellular mycobacteria. Right, it is effective only against the intracellular mycobacteria. Now, this pyrazinamide, if you see the mechanism of action, the mechanism, it seems to be similar to that of isoniazid. Right, mechanism is similar to that of the isoniazid. Alright, next. The other important point is the half-life. Half-life of this particular pyrazinamide is prolonged in hepatic and as well as the renal impairment. Okay, so if you take the half-life of this particular drug is prolonged. Right, the half-life, it is prolonged in both the hepatic and as well as the renal impairment. Right, in hepatic and as well as the renal impairment. Now, the other important point is in 40% of patients, this pyrazinamide, it causes non-gouty arthralgia. Right, 40% of patients, if you see the adverse effects, it will cause non-gouty arthralgia. Very important adverse effect associated with the pyrazinamide is hyperuricemia. Hyperuricemia occurs commonly but is usually asymptomatic. Right? So, the common adverse effect is hyperuricemia. Right, hyperuricemia, it occurs commonly but is usually asymptomatic, right? Now, but remember, if the individual develops hyperuricemia, it should not be stopped if the hyperuricemia develops. So, if hyperuricemia develops, it should not be stopped. Alright, if hyperuricemia develops, it should not be stopped. Next, the other important point is this pyrazinamide, it can also cause the hepatic dysfunction, porphyria and as well as photosensitivity. The other adverse effects are hepatotoxicity, porphyria and as well as the photosensitivity, right? So these are few points regarding the pyrazinamide. Now let me shortly revise about the pyrazinamide. So if you take this pyrazinamide, remember this is a weakly bactericidal drug, but it is more active against the slowly replicating bacteria and it acts within the acidic media. and it is effective only against the intracellular mycobacteria. And if you see the mechanism, its mechanism seems to be similar to that of isoniazid, but exact site is not known. And if you take the half-life of this particular drug is prolonged both in case of the renal and as well as the hepatic impairment. And in 40% of patients, this pyrazinamide causes the non-gouty arthralgia. And hyperuricemia, it also occurs commonly, but it is usually asymptomatic and it should not be stopped if the hyperuricemia develops. The other adverse effects with this is it will cause the hepatic dysfunction or hepatotoxicity, porphyria and as well as photosensitivity.